Yeah, I'm actually going to start with the dua and then we can start the talk at 11:35.
Okay.
May Allah make all of this knowledge, information, education, a good source of good resource for our community, for us. And may Allah reward our speaker, Sara Shah, for giving her time and effort to all of this. So I would like to start off by introducing our speaker today, Sara Shah. She's a licensed professional counselor. She's Austin-based, and she's a teletherapist and has her own private practice. She provides talk therapy or counseling to our Texas residents. She works with adult and couples, healing with intergenerational trauma and navigating communication concerns in their relationships. This is amazing. Very few people work through that intergenerational trauma. So we're really proud to have Sara Shah in Austin here doing that. And it is so important for our community in general, I think, to kind of talk about it and learn a little more. So I'm going to have Sara talk today about understanding therapy as a Muslim. Sara's doing this webinar. She's going to answer a lot of our questions regarding what it is to be in therapy and what does Islamic tradition says about it, addressing our unique mental health concerns that impact our Muslim community, and how to seek support and find the right therapist. We're going to answer some of the questions and answers at the end. Please hold on or type those questions in the chat, and then we'll try to get to it at the end of the session. We'll have this presentation, and then please reach out to us. Sara also has a website and her information on that ticket Eventbrite that NAMCC created. But you all can reach out to her if you all have other questions or want to see her in her private practice. So I'm going to have Sara take over. Thank you, Sara, for joining in, and really appreciate all your time there.
Thank you so much, Dr. Khan. Thank you for the introduction. I will go ahead and get started. So just like Dr. Khan mentioned, today I'll be addressing understanding therapy as a Muslim. I just want to start by, introducing myself. I know she kind of gave an introduction, but just a few things I wanted to reiterate. So I am a licensed professional counselor in Austin. I do teletherapy with adults, couples, and parents. I specialize in intergenerational trauma and communication concerns and anxiety. These are some of my credentials. You can also see them on my website, inshallah. And then at the end of the presentation, I'll also have a slide that kind of has my contact information as well. I'm going to see if there's a way for me to minimize my video because it's very distracting. Okay, there we go. So just a few highlights. Today, I'm going to be covering what therapy is, defining it, and what our Islamic tradition says about it. I'm also going to be discussing Muslim mental health specifically, addressing the unique concerns that impact our community and misconceptions that may exist within our community about therapy. And then I'll detail how to seek support, like who the different types of mental health clinicians are, what their role is, and how to find the right one. And of course, if just like Dr. Khan said, if y'all have any questions throughout the presentation, feel free to put them in the Q&A box, but we will answer all of them at the end, inshallah. So let's start with defining therapy. So before I dive in, I'd love to do a poll just to kind of gauge, what y'all know in the audience. And so let me switch to this other tab here. Okay, I think y'all can see that. So y'all can go to this website, www.menti.com, and use the code 37212930. And it should bring you to the screen. And whenever you get to the screen, just feel free to answer the question that pops up. What does therapy mean to you? Or in other words, like, how would you define therapy? I just kind of wanted to see what y'all know so far. Maybe y'all already know everything. So yeah, feel free to write in the chat if it's not working. I'd love to know. I'd love to know if this is working or not, because it's my first time using it. All right. Okay. So I'm just going to have some of the answers populate here. Nice. These are great answers. I think I don't have to do this presentation. Yes, these are beautiful answers. Yeah. So just to read through a few, therapy is a way to learn healthy coping skills with all of life's stressors and coping with our trauma. A safe place to express and process your thoughts with a professional that can guide you through that process. Healing, a safe space for people to navigate the various challenges that arise throughout life. These are beautiful answers. A way to learn about yourself. Yeah, absolutely. So gaining a new perspective on my experiences. Beautiful. So for the sake of time, I'm going to transition back to the presentation, but I appreciate y'all sharing your different responses. And I think it's really cool to just even see that a lot of y'all even know what therapy is. And hopefully there's still some things that y'all can take away from this presentation. So here, let's go back. Okay, so just like y'all described, like therapy is really, well, the first thing I want to highlight is like therapy, counseling, psychotherapy, and talk therapy are all synonyms. I think there's a lot of different ways people like these words are basically all over the internet. And so I wanted to kind of make it clear that generally whenever someone is using any of these words, they're pretty much interchangeable. So it's talking through one's mental, emotional, and psychological concerns with an objective third-party individual, a therapist, to gain deeper insight, self-awareness, and healing to live a more fulfilling and connected life. It can also include mediation between couples, families, or a parent and a child to build healthy, effective communication and repair those relationships. So just to highlight, mental health in general includes emotional well-being, how and what we feel, psychological well-being, how and what we think, and then social well-being, how we behave. So these things can be affected by biological factors, life experiences, family history. And I think something that like the Western definition of mental health and therapy has kind of gone away from spiritual well-being. And that's what I'm hoping to even focus a little bit more on this presentation. Like what does our Islamic tradition say about mental health and therapy? So spiritual well-being is also a huge part of mental health. And what that focuses on is, at least for us Muslims specifically, is like our connection to Allah, but in general, just this sense of creating this meaning for your life, finding a purpose in your life that really impacts your overall mental health. So a mental illness, I think, is also important to define. This is basically the equivalent of mental health disorders. Many people have mental health concerns from time to time, like as I just kind of broke it down, it's like very broad. So it's something that can impact any of us. But a mental health concern becomes a mental illness when ongoing signs and symptoms cause frequent stress and affect your ability to function. So if you're not able to complete your day-to-day tasks, then that's kind of when that could be a signal of like, okay, maybe I'm going down this path of potentially having a mental illness that is diagnosable. And so that's why I even want to do this presentation, for us to really understand, hey, what are our mental health concerns as a Muslim community, so that we can actually work on that before getting to the level of a mental illness. Or, and I'll talk about it a little bit more, sometimes mental illnesses can actually even be genetic. So you may have, different stressors that your peers may have, but just based on genetics, biology, just like, for example, in South Asians, like we are predisposed to having high cholesterol. And so in that same way, based on your gene pool, you may be predisposed to certain mental illnesses. And that's why, as a community, it's very important for us to know as well, how can we treat these things? Because just like high cholesterol is treatable, so is mental illness. We just need to know how to do that. So overall, the main thing I want to highlight is, in therapy, just as like a general umbrella term, like we learn to feel our feelings in a healthy way versus avoiding them or drowning in our feelings. And I hear this a lot from new clients, first-time clients, that they have this fear that if they really sit with their feeling or they talk about their feeling for too long, that they will never be able to come out of it. And I'm going to go into a little bit detail actually about what our Islamic tradition says about that, because if we look to the Prophet's Sunnah, we know that that's just not true. But we have to be able to learn how to feel our feelings in a healthy way. And the only way we can do that is if we feel safe in an environment to be able to even lean into that. And that's a lot of what therapy is. Like you're in this environment that is safe with this professional. Like a lot at the beginning of therapy, I'll talk a little bit further in this presentation, is you're creating safety, you're creating this relationship with your, like this professional therapeutic relationship with your therapist. And so just like we get hurt in relationship, we're also able to heal in relationship. And that's also one of the main foundational things about therapy. So I wanted to talk a little bit about what we can actually learn from the Sunnah of our beloved Prophet Muhammad sallallahu alaihi wasallam about therapy. And I think this is actually very fitting to discuss, especially with Ramadan coming up, because a lot of Ramadan is us focusing on our spiritual well-being. So, you know, there's this like people always are like, well, why do we need to go to therapy? The Prophet didn't go to therapy. And yes, that's very true. That's factual. However, he did, Rasulullah sallallahu alaihi wasallam, he did set the framework for therapy. And so as y'all can see at the bottom, I've also cited Yaqeen Institute. Dr. Rania Awad did this beautiful series on Islamic psychology that I would highly encourage y'all to look into. I'm not going to go into a lot of depth here, but she does go into depth about it. So if y'all are interested, please check that out. So the Prophet Muhammad sallallahu alaihi wasallam, he experienced stress, grief, and sadness, just like the rest of us. He experienced grief to, I think, a level that we cannot even fully comprehend. Like he buried all of his children with the exception of Fatima. And like that type of grief is one that I only pray that none of us have to experience. And yet there are still people within our own Muslim community that experience that level of grief. And he, even with all of these different experiences, he did show us how to cope with these things in a healthy way, as hard as it can be. He did reframe suffering, which is a lot of what happens in therapy as well. Because, you know, oftentimes when people come to therapy is whenever they've tried everything else, you know, and their situation may feel very hopeless. And so one of the things the Prophet talks about or did mention is that, you know, Allah tests those he loves the most. And like what a beautiful thing to think, because I think human suffering, like pain, that is something that is a fact, unfortunately, about this life, you know, as we all believe as Muslims, like this life is a test, you know. But to think that, oh, Allah is only testing me because he loves me so much, like that can really help us reframe some of that. How would I frame it? Like sometimes, like whenever we feel very down on ourselves or very hard on ourselves, you know, or blaming ourselves even, reminding ourselves that like this is coming from Allah who loves us, you know. And then the Prophet Muhammad sallallahu alaihi wasallam, he talked about acknowledging feelings, not suppressing them. So I think, I don't know if this is a later bullet point, but I'll just mention it here. So I've recently been listening to the Prophet Sara, and I want to front load, like I am in no way an alima. So if I'm saying anything incorrectly about the Prophet's Sunnah, that is on me. And, you know, inshallah, please forgive me and please correct me if I'm wrong. But, you know, there's this, it was either a hadith or something, like a story that Yasser Qadi was sharing in the Sira, that the Prophet Muhammad sallallahu alaihi wasallam, even years after his parents passed away, like he went to their grave and he was with his friends, you know, he was with the Sahaba, and he just sat down and he started crying, you know, like how often do we hear about, especially Muslim men, like just really crying in front of their loved ones? Like I think there's this misconception that if we cry, we're not strong. We have to show that we're strong, we're not weak, And if we're looking here at the Prophet Muhammad sallallahu alaihi wasallam sunnah, and he was the best of people, and he felt no shame in sitting down and crying and really expressing his grief in this way, then who are we to say that we can't do that? How and an important way that he described, that Dr. Rani actually talks about, is the way we talk about our pain, this is something you learn in therapy as well. This is something I work with my clients on a lot, is how are you talking to yourself about your pain, about these experiences you've had? Because a lot of times as humans, we blame ourselves or we blame other people, and I'm sure, if you're married or, have even children, like sometimes that can show up as unhealthy communication in your relationships. If you're not acknowledging your feelings and taking responsibility for your piece without blaming yourself. And so that is that self-compassion piece that is also discussed in therapy. And this is all from the Prophet Sunnah. Like, who would have thought? So that's kind of the example I gave. And one of the biggest things that, unfortunately here in the US, like I know in like back home, there's this like collectivistic culture, or like how I would describe that as like this healing in community that happens. Like there's a lot of, like a lot of like open, at least from my experience, like it's like your house is almost open, like, family members are coming in and out, like you're never really alone. Like you always feel that sense of like people surrounding you. And yeah, I feel like even now, present day, like to some degree, that's even shifting there. But especially here in the US, like we don't have that same sense of community healing or connectedness that maybe a lot of our parents or grandparents had growing up. And so even looking to the Sunnah, like, okay, if the Prophet Muhammad sallallahu alaihi wasallam, like he had such a huge, he put such a huge emphasis on community. How can we think about that? And I'll talk later about that a little bit when it comes to misconceptions, because I thought that was a very interesting point. And then this is a huge one, like meditating and praying and reflecting in Cave Hira. Like we've heard countless stories about how the Prophet Muhammad sallallahu alaihi wasallam used to do that. He even received the first revelation while he was doing this in the cave. And therapy kind of, and the way I want to phrase this is, and I'll talk about this later in misconception as well, is that praying, like prayer is one of the biggest foundational pieces of our religion, of our faith. And so I know sometimes, sometimes whenever we're praying, I'll give my own example. Like sometimes when I'm praying, I feel like I'm just going through the motions versus really letting myself be present and really just be in my prayer, and in therapy, that's a lot of what you're doing. You're slowing down and learning to be present, so you're not feeling anxious, worrying about the past, or feeling depressed, worrying about the past or future, like you're really being present. So this is a huge piece from the Prophet's Sunnah that we can really look to. And then of course, this Sahih Hadith about like seeking out cures. For every disease, there is a cure. And just like, mental health concerns, mental illnesses, like there is a cure for that. And as, people who are part of the Prophet's Ummah, like we have to be open to finding those cures. So I wanted to go a little more into detail about therapy in the Islamic tradition. There are actually a bunch of scholars, and Dr. Rania talks about this in that series, so I would highly encourage y'all to check that out if I haven't already said it. But there's a lot of scholars actually who talk about therapy, or they didn't maybe use that exact word, right? Because the word is maybe more recent, but and this book is actually one I've recently purchased. I haven't read yet. However, I'd encourage y'all to join me on that journey of, he literally talks about sustenance of the soul. So like ilm nafs was like something that started as early as the 7th century within the Islamic Ummah. And so there's a lot of different scholars who talk about different things related to therapy and mental health, but I'm just going to focus on al-Balkhi for the sake of time. So one of the really cool things that al-Balkhi did is that he acknowledged shaitan's waswasa as like a part of, maybe mental health concerns. And he also included like the biological and cognitive explanations and looked to the sunnah. So, I mean, like, how beautiful is that? Like, we can turn to our religion for so much. And I think the mental health, therapy, psychology aspects of it are unfortunately things that have gotten lost in time. And so, that's one of Dr. Rania's like huge initiatives, is bringing that back. And, my hope is for us to kind of see that overview here as well. He also basically described what the present day diagnosis of obsessive compulsive disorder is, and even the present day treatment of exposure therapy. And unfortunately, this is now credited to, a like white man who and unfortunately it doesn't date it like in our textbooks. Like even in my counseling program, I didn't learn about this, but this is huge. Like there's a huge erasure of Islamic tradition, both in this Western culture and even in our own culture, right? So we can blame them, but like how much are we erasing within our own community? So if we can start there, my hope is that, we can actually have it come back. He also discussed depression, which can occur through either environmental factors or chemical factors. So like I talked about in a previous slide, mental health, mental illnesses, they can be impacted by, your current environment, your stressors, different traumas you may experience, or also genes, like your genetics, biology, all of that. And so he talked about those pieces, and he also even came up with like present day, the way that depression is treated, especially if there's those chemical factors included, is with medication and talk therapy. And that was something he identified in the 9th century. And that's still the treatment we're using today. Like that's amazing. And he encouraged people to seek mental health treatment. And again, with this hadith, like, I'm bringing it up because it means something, for every disease, there is a cure. And yes, this is the link to that series that Dr. Rania does about Islamic psychology. So I took this from the Yaqeen Institute, and I'll have a slide that kind of details different Muslim mental health resources, but I thought this would be really helpful to include because with Ramadan coming up and, us talking about spiritual well-being being a part of mental health, there's even this idea of muraqaba in the Islamic tradition that is literally the practice of exercising mindfulness. And that is exactly what is done in therapy. And so, I'm like, y'all can see this, it's not the easiest thing to do. And so that is why in therapy, like you're working with a professional to really be able to incorporate this into your life. But I think it's amazing that they even have infographics like this, because this is still something we can practice outside of therapy too. All right, so now I'm going to transition a little bit to specific concerns that impact our community as Muslims. And before we do that, I just want to, see if y'all are still with me. And so let's do another quick check-in. So go to same website, menti.com, and the code is 68416893. And the question I want you all to answer is, what factors impact the mental health of Muslims in the US? So you can discuss unique concerns you think impact us as Muslims, concerns that impact you. As you all saw in the last question, this is anonymous, so I don't know who's sharing what. But I just kind of want to gauge for what impacts our community. That is very true. Mm-hmm. Mm-hmm. Yep. the patriarchy is a concern, even in the Muslim community, even though Islam teaches us that we do not need that. Yeah, thank you guys for these answers. Yeah, acculturation, poverty and work stress, shame from others' judgments. Again, that could be within our community, could be outside of our community. And like we all know, Islam doesn't teach us to shame or judge other people, and yet it still happens. And so how can we address that? Cultural expectations from immigrant parents trying to break cycles of abuse. Yeah. I think as a community, it's really hard to look at these things because I mean, at least this is how I even perceived our community growing up. But there is this idea that, us as a community, like, we follow Islam, so like we don't have these issues, or like, oh my God, like there's almost like a shame associated with like, man, like our religion is like our guide, and we are still having these issues in our community, and like, just like I was talking about looking to the Prophet's sunnah, like if these issues existed at his time, and he wasn't even able to combat all of them within his community, like who are we to say this doesn't exist in our community today? Like our Prophet isn't even here with us physically. Like, yes, we have the Quran and we should all turn to that to guide us. However, these things still exist. And so how can we make space? How can we make spaces within our masajid? How can we make spaces within our community to even talk about therapy? Like, hey, you can heal from this in that professional setting, either through couples counseling, through family counseling, through individual counseling, or even create more programming like this in masajid where we're actually having these conversations. I think it's huge. So thank you guys for these answers. I'm going to transition back here. Yes. Okay. Yes. So just like y'all mentioned, factors that impact Muslims in the US, we have post 9/11 discrimination, Islamophobia. That was a huge thing that impacted us, impacted our community specifically. As I'm sure y'all are aware, like the Holy Land Foundation 5 were put in prison wrongfully after 9/11. And like their families are still dealing with that today. Some of them are still in prison. And so how does that impact these families within our community? Like these people are part of our Muslim ummah, like it's very, very painful and hard. And the immigrant and refugee experience. I know I wrote it out together. It was just for the sake of spacing, but I know that even within the immigrant and refugee populations, the experiences are very unique, very different. And some of the things I want to highlight, there's this sense of like losing your identity that happens. Like you're coming, like I can't even imagine, even my own parents, like coming to a foreign land, not knowing the language 100%, not knowing the culture. It's a very hard experience, and it impacts everyone differently. There is a huge, I think, impact on like financial stability. There's a huge push for that. And, I'm sure as y'all can see within our community, like that's why a lot of us are like always taught from a young age, like education, like strive for that stability. Because oftentimes our parents didn't have that. And that can, create a difficulty finding the sense of belonging, which, I mean, that's even why these masajid were formed, right? So we can have this sense of community. And I think it's beautiful that, we've worked together as an ummah to create this for ourselves. And how can we continue to bridge some of that connectedness? I think, and that's why, like, that's one of the beautiful things about iftars is that, maybe the whole year, like, some people are coming to the masjid for different prayers, but in Ramadan, like the masjid is packed, like there is a huge sense of community. And so even thinking about like, okay, this is from the sunnah, this is in the most holy month of the year, how can we have this throughout the year as well? And, even talking about the immigrant and refugee experience, like these parent and child cultural differences that happen as a result of that. And that can cause a lot of tension within families. And, our families are what make up our ummah. And so that is a huge thing that can be discussed in therapy and worked on as well, to kind of help mediate and resolve some of those conflicts and concerns. And another piece I wanted to bring up too is that for the immigrant and refugee populations, I think there is a lot of like survival mode that gets turned on, like like especially initially whenever you first come to America, you're trying to, and I mean, I'm speaking from what I've seen. I don't want to speak like I've lived this experience because I have not. But as a result of those experiences, what I've seen is that oftentimes these populations have learned to avoid or suppress some of their feelings just as a means of survival. Like kind of what I talked about in a previous slide, like a big part of therapy is learning how to feel your feelings in a healthy way. If you're avoiding them or suppressing them, that can potentially lead to concerns in your relationships, for yourself personally. And also I want to acknowledge that this is used for survival. And so sometimes our coping skills can be avoidance and we need it to survive. And so if at any point you feel like, hey, I want to change this, or hey, this isn't working for me anymore, that's also in therapy can be helpful. Marital strain and divorce. There is divorce that happens within the Muslim community. There are a ton of factors that impact that. And so how can we create systems in place so that people feel comfortable? Maybe even imams, and this is like actually a new thing that I've heard of too, like sometimes even imams, before they even do the nikah for people, like they say, oh, I need to see that you went to premarital counseling. Because this is like, we have this tool, we have premarital counseling that exists. And so if we have this tool, how can we incorporate it so that we're making sure we're setting ourselves up for marital success from the beginning? Because marriages, as the hadiths say, like marriage is half our deen. And so if it's this big of a thing, that means it's also a huge responsibility. So we need to figure out how can we set ourselves up? How can we set ourselves up for success from the beginning, or even as concerns come up, knowing that you can turn to therapy or counseling. And one of the things I want to mention about this too is I think that sometimes culturally the piece that comes in is like, and that was kind of what I was talking about with community. Like we have this sense of community back home, like in our homelands. And sometimes the way this stuff was handled was by bringing in, oh, let's bring in the elders to kind of help resolve our marital concerns, or let's just pretend we don't have marital concerns, even though your kids will pick up on it. And so where this causes issues then is because then it becomes this huge family issue. And while you can end up forgiving your spouse, sometimes then your parents cannot, or your siblings cannot. And so if we have counseling in place, a professional, a third-party objective person that doesn't have any stake in the marriage, like maybe your parents or siblings do, how can we normalize turning to that for support to resolve these issues that will come up? Like in marriage, there is always conflict. It's just we need to learn how to have that conflict in a healthy way. And also there is marginalization of minorities within our community. Again, something we don't like to talk about, but there is racism within our Muslim community. There is sexism within our Muslim community. And so those populations, those groups are impacted by this. And how does that show up within our community? And how can that show up in therapy? Yes, and so how these concerns may show up in therapy is, as a result of all these factors, you may experience a lot of stress. So in therapy, you can talk about like how to balance all these different life roles, specifically academic and work stress as well, communication between spouse, parent, child. If you feel misunderstood or hurt a lot, if there's frequent conflict within your home, that's a great reason to go to therapy. Feelings of sadness or worry. If your usual coping skills aren't working anymore. So like I mentioned, like survival can lead you to avoid or suppress a lot of feelings, which is totally normal, and a thing that helps you get through life. And sometimes at some point that doesn't work anymore, and that's okay. And that is why therapy is there, for when you're ready. Grief and loss. And this is one of those sure things that in Islam we are taught, like the surest thing about life is death. And so when you experience the death of a loved one, that is also a great time to come to therapy, because as anyone who's experienced grief, grief shows up differently for everyone. There's no one exact way to go through it, and having that safe space for you to talk about your feelings related to it can be really helpful. Because I know, especially with death, within homes, like if you lost a parent, especially when you were younger, like sometimes your surviving parent or even your relatives may not want to talk about that because they are still processing that grief themselves. And so you may feel alone. You may feel alone in your grief, and you want to like share it and talk to them about it, and they're just not ready for that yet. And so that's where therapy can be really helpful. Chronic physical symptoms. So sometimes the way stress can show up, maybe we're not even thinking about stressful things, but our body will tell us, hey, you're stressed. And that'll show up by like stomach aches. I have a ton of clients, even myself, like whenever I'm feeling anxious or nervous, my stomach hurts. That's a huge sign for me of like, okay, I need to check in about this. I need to do some of my coping skills to make sure I'm dealing with that. Because as you know, any doctors in the community will tell you, like over time, headaches, chronic stomach aches, that can lead to other concerns. And so we don't want to have, our physical health as an OMA declining either. And preventative, like I mentioned, premarital counseling, and I don't have it written on here, but if you have a huge life transition coming up, not just marriage, maybe you're moving to another state, like anything like that, you can talk about those concerns in therapy so you feel ready to make that transition. You feel like, okay, I have these coping skills. So if feelings of sadness, if feelings of worry come up, I know how to handle that in a healthy way. So now I want to jump to addressing some misconceptions we may have about therapy, or just some things I've heard. So I was kind of alluding to this earlier, that there's a misconception that therapy is a Western concept. However, as we also discussed, focusing on holistic health, including mental health, is a part of Islamic teachings. And yes, the Prophet didn't go to therapy, but he set up the framework for it. And nowadays, even in the therapist community, there's a huge push for cultural competency. And what that means is that as therapists, we are trained and forced to be trained to be culturally aware whenever we deal with our clients. And there are a lot of resources now to find these culturally aware therapists. And the good news for our community too is there's a lot of Muslim therapists that exist now, which is huge because that didn't exist just 10 years back, which is crazy. Tying it back, like Islamic scholars have compiled therapeutic interventions from Islamic teachings beginning almost a millennia ago, like Al-Razi, Ibn Sina. I'm sure a lot of y'all have heard these names, Al-Balkhi, like they used Quran and empirical research. And the first holistic mental health hospital actually opened in Baghdad in Iraq in the 7th century. Like mental health is literally a core part of our Islamic tradition. This is the point I'm trying to hone in case y'all can't tell. There's also this huge misconception that going to therapy means you're crazy or that there's something seriously wrong with you. However, as I hope y'all have gathered so far, is that having mental health concerns or mental illnesses is a normal response to genetic and environmental factors, and it can be treated by therapy and or medication. It does not make you crazy. You also don't need to be in crisis to seek therapy. It can be preventative. So like I was mentioning, if you're noticing that you're having frequent headaches, how can we address that up front? Like going to therapy, talking it out. That's how you can even learn to build some awareness early on. And I'll talk more about that later. For every disease, there is a medicine. Just like that hadith I've been saying multiple times. So this is something I also see very commonly within our community. And this is a big cultural piece, I would say, that like family matters are private and should be safeguarded from outsiders, even therapists. And yes, this is a very normal value to have, I will say, like privacy is very important. You want to, especially like when I even think about like the immigrant refugee experience, like you come here to a foreign land and like, how do you know who's safe? How do you know who to trust? Well, you know, your family's safe and you can trust them. So that's why I think a lot of these immigrant and refugee parents will then push their children to say, hey, keep our concerns at home. Like, we don't know what other people are going to say, what they're going to do, what they're going to think. And so I want to normalize, this is a normal value. The piece I want to add to it is that therapy is confidential, and a therapist isn't just any person. They are a professional. Just like you go and you see a doctor, you see you see any type of doctor, dentist, whatever. Like, there's strength in asking for help when needed, even if it's outside the family from a trained professional. I think asking for help, asking for support is something that we don't really highlight a lot within like this general culture within our community. Like, okay, we can figure it out. Or like, oh, it's not that bad, or even like I notice a lot, like for children of immigrants, we're like, man, my parents went through all this, like, and I'm asking for help about this thing, like really minimizing, really like making your experience feel very small compared to theirs. And to that I say, like, and kind of like one of my specialties that I had mentioned, like that intergenerational trauma, like if your grandparents, like, I'll give this example, like if your grandparents experienced the partition, they had to flee India to go to Pakistan, or, like that is a very hard experience that we can't, like, as children of immigrants, we can't even wrap our mind around, and then our parents after that, they experience whatever, they experience growing up in that sort of environment from their parents. And then they immigrate, they immigrate to the US. And now here as their child, you may have this, you may notice you have anxiety, or you have nervousness, or you have depression, and all of these things are related, like, just like our, what is it called? Like, just like, we can inherit high cholesterol from our grandparents, we can also inherit their trauma. And so, yeah, that was like a sidebar, but yes, therapists are professionals, and everything you talk about is confidential. And so prayer and connecting, okay, yeah, so a misconception is that prayer and connecting to Allah can cure your depression and anxiety, and you don't need therapy. Depression is just a lack of faith and gratitude. So depression is very real and very valid, along with any mental illness, any mental health concern. It's a normal response to biological and environmental factors. And while we talked about like faith and connection to Allah can help ease our pain, as it did for the prophets, that connecting to our spiritual well-being, it's not always the only cure, because just like spiritual well-being is a part of our mental health, like I talked about, there is the emotional, the psychological, all of those other pieces connected to it too. So struggling does not equal weak faith, because the prophets, as we talked about, the prophets struggled too, and they were the best of people. So if they struggled, how can we not struggle? Like, that's impossible. Like even this example directly from the Quran, which I think is huge. Like, Yusuf Islam's father, like, he experienced such sorrow that his eyes turned white from grief. And I think there's a lot of different interpretations, like either his, he lost a lot of his sight, or he went completely blind. And so that's even that connection of like, the stuff we feel physically, there's the stuff we feel emotionally, mentally, that can impact our physical health as well. And sometimes you may notice your physical health symptoms declining before you really tune into that emotional, mental, because, as humans, we're really great at avoiding things. So, and then also this hadith about tying your camel first and then putting your trust in Allah. Like, yes, of course, make dua, like pray. If you're feeling any sort of sadness, any sort of struggle, and tie your camel first, like go to therapy, seek support, at least talk to somebody, at least let someone know you are also struggling, so it's on someone's radar. You're not alone in this. Yeah, then this is also a misconception. Like, going to therapy means you're weak or lazy and you're not trying hard enough to work on yourself or fix your situation. And I see this a lot, especially with children of immigrants. So a therapist's approach to clients from the perspective that the clients are actually the experts on their own lives. So although we teach coping skills and tools, a lot of the stuff that you need to, like, quote unquote, fix your situation, you may know it already. You're just there's some barrier that's making it difficult to do that thing. So like even Ibn Sina talked about this, like he said that the human spirit is equipped with the ability to restore mind and body. The task of medicine, and with medicine, he meant like all types of medicines, including, psychology stuff, is really just to aid in this process. So he recommended medication, meditation, dialogue, reflection, imagery, and all of that is parts of talk therapy. So let me see where we are on time. Okay, so I want to detail a little bit about, like, now I've told you all this stuff. Like, I hope I've set some level of framework of like, okay, here are the issues we struggle with as a community. Here's what our Islamic tradition says about this. And so if you feel ready, or if you just want to know, okay, what can I do with this? How can I seek support? Let's talk about that. So I'm going to go over this very briefly because I do get this question a lot. There's a lot of different therapist credentials, and for all intents and purposes, like, all of these people can provide talk therapy. So I myself am an LPC. So the social, like, LMS, so the first line, LMSW, LCSW, that's social workers, then there's professional counselors, and then there's marriage and family therapists. So all of us have gone and gotten our masters. We've completed 3,000 hours of residency. And so that is what they do. And then we have psychologists, and we have two different types of psychologists. So ones that have a PsyD, and then some that have PhD. And so the difference between this column and the first column is that so psychologists, they get their doctorate degrees, like PhD or PsyD, and in their training, they do focus on like research and also doing assessments. So they can do a lot of assessing as well. And then psychiatrists, they are MDs, they go, like Dr. Khan, they go to medical school and they can prescribe medication. So that's like one of the biggest difference, but all of them can provide talk therapy. So what is a therapist's role? I also get this question a lot. So therapists reflect a lot. It's basically like therapists are almost mirroring what you're saying so that you can hear yourself say it. Because I think a lot of times we don't really hear ourselves. And if we really heard the stuff we were saying about ourselves, or even to other people, or the way we were talking about other people, I think we'd really, like, it'd kind of be like a wake-up call almost. Like, sometimes we need this objective person to tell us, like, hey, yeah, so you're saying this, but you're also saying this. Like, what? Because sometimes, if our parent says that to us, or even like our spouse, or like a what is it called? Like a friend, like, we get very offended, we get very defensive. And so this therapist is like an objective person. And so sometimes we need to hear it that way. Therapists ask a lot of open-ended questions. So the purpose of these open-ended questions are for you to be able to understand your situation in a different way, to think about things that you haven't thought of so far. Tool and skill building. So there is a level of teaching that happens in therapy. We try out different coping skills and tools. If it doesn't work for you, we reassess and we try other tools. And a lot of active listening. And this is the reason I even bring this up, is because also as a community or a culture, we have moved away from actively listening to people. Whenever we're communicating, whenever we think we're communicating with people, sometimes we're half listening. Like, our phones are great distractions nowadays. I hate to be that person, like, your phone's bad, but like, there's a lot of distractions in the world, whether we're thinking about something else, whatever. So active listening is such a huge part of therapy. And I'll kind of detail that a little bit more.
But ultimately, therapists provide objective support and guidance. They're not forcing their opinions or advice. So I think another, like, a misconception I could have added, but I'll say it here, like, is that a therapist, like, if you, like, for example, if you bring your like teenager to therapy, I think sometimes parents have this misconception that, like, oh, okay, like, can you make my teen pray, or like, can you make them like stop dating, or like, you know, do these different things? And to that, I always say, like, that's not my job. Like, what makes you think that your teenager will listen to me, a complete stranger, over you? You know, like, you are their parent, you've known them your whole life. So it's not so much that the therapist is trying to change them. It's more of trying to help them understand, yeah, like, why are you dating this person? Or like, oh yeah, what made you stop praying? You know, like, let's address that. So that's where the open-ended questions and active listening come in, and mirroring back too, you know, like, because if, for example, if your teen's saying like, yeah, I mean, I would love to have this connection to God, I just like don't know how to do it. Oh, okay, that seems to be the root issue. Like, let's talk about that. This is like a very simplistic example, but just to kind of give you all an idea. And also this modeling a healthy relationship, you know, so this is why that active listening piece is so important, because in a lot of our relationships, unfortunately, that isn't there. And so in your relationship with your therapist, like, you're able to see like, okay, this is what healthy boundaries look like. This is what a healthy relationship can look like. And I am capable of like achieving like health in my relationships. And what happens in therapy? So I say this to all of my clients, because I think there's also this, we have this culture of, how do I like word it? Like, there's like we live in a very capitalistic culture. And what I mean by that is that everything is very go, 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 very achievement focused. And so, I mean, in Islam, like, you know, we're supposed to slow down 5 times a day and pray, you know, and like I talked about, like, sometimes we're praying to go through the motions, or like, oh my God, I have a work meeting, let me like pray the real quick, you know? So we're not really slowing down to really do a check-in with ourselves, like the Prophet Muhammad sallallahu alaihi wasallam did in Cave Hira. Like, he would literally go there to slow down, seclude himself from the, you know, fast-paced life, and just really be with his thoughts, be with his feelings. And that's exactly what happens in therapy. So you're building awareness. So I have a little picture of looking at yourself in the mirror. Like, you're talking through a lot of different experiences you've had, and the role of the therapist is to help you figure out those patterns in those experiences as well. So that you can build connections and understand, oh, this is why I do this thing. And now that I know this is why I do it, now I can change it. No judgment. In therapy, there is no judgment. And this is something we don't get a lot outside of therapy. And so that's why a lot of people even come to therapy, because they're just like, man, I've tried everything at this point, and I just need a space to come where I can just like figure out what I need to do without people, you know, telling me what to do. And collaboration. So therapy is a relationship, like, it's a therapeutic relationship. And so I even tell my clients, like, when I give them a tool or a coping skill, I'm like, hey, like, you can try this out. If it doesn't fit for you, I will check in and ask you, and you can let me know if it doesn't work. Because if it doesn't work, I want to be able to give you something that does work for you, because everyone's different. And that's how we collaborate. I'll go over this really briefly. The main point I want to make about what to look for in a therapist is the connection. So like, research has shown that the client therapist connection is the #1 thing in determining like success in therapy. So it's okay to try different therapists, just like you try different doctors. This is also a huge part of Islamic psychology tradition. So Al-Tabari, he put a huge emphasis on the importance of connection between the provider and the patient. This is part of our tradition, quite literally. The other piece I'll name is that, and I think so actually, let me talk about that here. So some of the places you can find therapists are either by calling your insurance, if you have an insurance provider, and asking for an in-network list of providers. You can also do research online. These are some great websites. I'm going to do a plug for the Muslim Association for Psychological Services, which started in Dallas. And so they have therapists in Dallas, Austin, we have a chapter here as well, and then in Houston too. And so if you want a Muslim therapist, that is, I would say, #1 place to look. And out of network therapists, so if you don't have insurance, or if you see a provider you like, but they don't take your insurance, you can ask your therapist to actually give you a super bill if you still want to use some level of insurance. So what I mean by that, and some of y'all may already know this, but I've been noticing a lot of people don't, so that's why I want to say it, is that you can ask your out-of-network therapist to give you a super bill, and depending on your out-of-network benefits, you'll actually get some reimbursement directly from your insurance. So if you want to do that, you can call your insurance and see what your out-of-network benefits are. But the thing I want to pause here for a second to name is that going to therapy is a privilege. And what I mean by that is that it is a financial investment. And so this is something I hear a lot, and this is the reason I want to address it, is that therapy isn't cheap. And I recognize that even as a therapist, and that can be a huge barrier. And that's why in the next slide, I'm going to go over some like low cost or even free therapy that exists in the Austin area. But the piece I want to say is that, even if you're not going to therapy, like I talked about, there's different things that we can be doing in general to incorporate some of these Islamic psychology traditions in our day-to-day life. Like this is literally part of our tradition. And so how can we incorporate addressing mental health? And that is why this series exists. Like this is us trying to incorporate this into our community, integrate this. Yes. So these are some low-cost free therapy options in Austin. Y'all can take a picture of this if you want, or I'm going to, inshallah, my hope is to include this stuff in my website as well. And so if y'all want like a one place to kind of have this listed, I will do that. And these are some Muslim mental health resources. And as y'all can see, the slide is very full. Like this is one of the things that's so beautiful that's been happening for the past several years, is that there has been a huge push in our community toward mental health. And so a lot of these different organizations I've listed here, so like Nasiha, for example, has a helpline that you can call at any time. A lot of these other places do a lot of research related to Muslims and their mental health. Dr. Rania has a Muslim mental health and Islamic psychology lab, and she also started Maristan. And SEMA was also started from these two, I believe, South Asian women, sisters, whose mom passed away from a mental illness, and you can read the about on their website. So this is a great resource if you have someone in your life that is struggling with a mental illness in your family. They didn't have those resources when their mom was struggling, and so that's why they created this initiative. And so beautiful, beautiful resources. Very excited for our community. And these are some Austin specific crisis resources. I know I didn't talk specifically about crisis in this presentation because that wasn't necessarily my goal, but I did want to include it because I know it's important. And so if you're experiencing domestic violence, which unfortunately, I don't think I'd mentioned this, but unfortunately in our community, this is a thing. This is a very common experience, unfortunately, even though our religion teaches us not to do this. So in like the previous slide, the Texas Muslim Women's Foundation, based in DFW, like they provide this space specifically for women and children who've experienced domestic violence or abuse. SAFE is like Austin's crisis resource for that. And so I put the crisis hotlines for Travis County and Williamson County, and this is on my website as well. So that brings us to Q&A. And I think we have 30 minutes. Yeah, I think we have 30 minutes. So if anyone has any questions, don't be shy. You can write it in the Q&A chat. I think you can directly message me. Let me see.
Yeah, they can put it on the chat. They can raise their hand, and maybe we can unmute them, and I know somebody's raised a hand. But thank you, Sara. That is really well put together, comprehensive, way of talking about therapy and really addressing the first biggest factor is why we should get therapy, right? I think they said, I liked how you challenged it from a way of saying so many people always kind of go against therapy using Islam as a way, but how much of research, I love that book, Sustenance of Soul. There's so much of good stuff there, and understanding some of that big scholars that came from Turkey and how they did all of that work on mental health, psychology, some of Sufism, if you understand. I've been reading this book called The Divine Love. And
Yes.
I kind of mentioned to you this before, right? It's a really good book of connecting with Allah and how you can kind of understand it from a psychological perspective. But yeah, and the resources, right? That is really amazing how we've come a long way in for Muslims. And honestly, Family Youth Institute is another institute which is doing research in Chicago, really talking about divorce rates, big struggles, teenage struggles. They study it across religions, and they found that we Muslim community is struggling the most, highest divorce rate compared to other religions, highest
suicide
rates.
rate.
Yes, we're not talking about it. So we have a lot of resources, and we should start talking about it because our community is struggling in America compared to other religious communities. So that kind of tells us why we need to talk about this even more.
Because we have a lot of unique struggles. We have a lot of unique struggles that we don't talk about. And as a community, if we did talk about them, there would even be so much healing in just us as a community talking about it with each other. And that's why I even brought up that point of like, during the Prophet Muhammad Sallallahu Alaihi Wasallam's time, like there was just this more connectedness, more openness, like the Prophet's crying in front of the Sahaba, like, how often do you see that happening?
Yes.
So I see some questions here. So let me see if I can answer them. So how do I choose a therapist? How do I know if my therapist is good or if we are a good fit? Great question. So on one of the previous slides, let me go back and see if I can. Yes. Yeah. Okay. Yeah. So these are some of the main things I would recommend looking for whenever you're choosing a therapist. But whenever I say connection, the thing I mean by that is so different therapists on these websites that I posted, like they have like a bio that they wrote out. They have like a website. So I encourage you to look through it and see if there's something written there that you connect with. Therapists also all offer like a 15-minute free phone consultation. And so in that consultation, you can also get a better feel for what type of therapist they are. You can tell them some of your exact concerns you're having. And then the reason I even wrote that it's okay to try different therapists is, if after, like, I usually say, like, give them at least 3 sessions before saying like, okay, no, unless there's like something really specific or drastic where you're like, okay, absolutely not in the first session. But usually after 3 sessions, you can kind of get a better feel of whether or not you guys vibe or connect, or you feel understood by them. If you have more specific concerns of like, oh, I feel like nothing's happening, I feel like I'm still the same. That's kind of why I even brought up the point of like therapy is a process and you're slowing down. So you're coming to therapy with sometimes like years of hurt, years of pain. And so it's impossible for us to just fix that in a month, And I see another question related to that actually. So let me answer that first. How long can we expect to spend in therapy? So that is a great question, one I get asked a lot as well. And it's so hard to answer that question because everyone is so different. It depends, how long you spend in therapy depends on what concern you're bringing in. It depends on how often you're able to come to therapy. And the reason I say that is because I think sometimes people are like, oh, I can come to therapy once a month. But if you're coming once a month, you're doing like a very high surface level check-in of like, here's what happened in the last month, versus if you're coming every single week, then at least initially, you're able to dive further into your concerns. You're able to, like those connections I was talking about, you're able to really, your therapist is able to help you understand some of those patterns, some of those, like build some of those connections.
Yes. And then how do you gently encourage a family member to go to therapy? Yes, great question. So, so with this is a very interesting question because I will see a lot of this happens a lot with like couples, I think, and then like parent-child stuff. So like, everyone loves to blame the other person, so with this question, sometimes I even recommend like, you can bring it up. You can say like, yeah, I'm like, for example, like hey, I've noticed you've been sad. Like, like what are you needing? Like, I would just start with what are you needing? Like, if they're saying, oh, I don't need anything, I need some space, or like, yeah, I just need someone to talk to. Okay, then you can say, yeah, like, I'm more than happy to talk to you. If you notice they're like dumping a lot on you, or you notice like, hey, I feel like I can help you this much, but beyond this, not so much, then you can kind of say, hey, I feel like some of your concerns could be helpful to talk to with a therapist. You could send them the link to this webinar. And then the piece I add to that then is like, if you can't get your family member to go to therapy, then maybe you can go to therapy and you can model that for them of like, hey, I'm going to therapy as well. Here's how it's helped me. Or if you're noticing, oh, this person is the one causing problems in my life, then, you can come to therapy and actually figure out and address what your role and your responsibility is in that as well. Because that's what therapy is. It's, building that self-awareness, looking in the mirror. I hope I answered those questions. If I didn't, please feel free to unmute yourself or ask a question again in the Q&A box.
And the therapy part I also like about is when families are arguing and can get to some sort of a parenting technique, going to therapy, using this person as a negotiator, like you said, third person party. And sometimes I see families come continuously for 6, 7, 8 weeks or 6 months, and then they take a break and I don't see them, and 3, 4 years later they're back because they have a different issue. So because they know this therapist, they have this almost like a bond that they can go back and say, hey, you remember we kind of dealt with this then, now we're dealing with something else. So it's a continuum in a way, but at the same time also has breaks in it, in how long you do therapy.
Yeah, therapy is a relationship, it's long term. You can come and go.
Yeah.
Any other questions? Like I said, you can write in the Q&A box or you can unmute yourself. But if you have any other questions and you don't want to, you can also ask anonymously if you want. But if you don't want to ask them here, or you have something like very specific for me, this is my email address. Emailing me is the best way to get in touch. And I'd be happy to answer your questions.
Awesome. Thank you, Sarah. Thank you very much. Really appreciate it. I want to stop this recording.